Utilizing a tibial guide that allows for optimal tunnel placement, position the tibial guide appropriately and drill the guide wire. After the graft size has been determined, ream over the guide wire with the corresponding reamer. When the tibial tunnel has been completed, position a femoral aimer into the over-the-top position through the anteromedial portal. Drill a calibrated guide wire through the femoral aimer and the lateral cortex of the femur. Drill over the guide wire with an endoscopic reamer corresponding to the diameter of the graft diameter, and ream to the depth that will allow the desired soft tissue graft-to-tunnel interface. Drill over the guide wire with the 4.5 mm ToggleLoc drill bit through the lateral cortex of the femur. Pass the depth gauge into the femoral tunnel and measure the tunnel length from the lateral cortex of the femur to the tunnel exit point in the joint space. Use the measurement obtained with the depth gauge to mark the loops of the implant to ensure deployment on the lateral cortex. Make a second mark on the graft by measuring the depth of the graft tunnel. Thread a strand of relay suture through the eyelid of the graft passing pin and pull the relay suture through the skin. Use a suture grasper or crochet hook to retrieve the relay suture through the tibial tunnel. Loop through the passing suture of the ToggleLoc device. Ensure that the ToggleLoc device is oriented laterally and pull the passing suture proximally until the mark on the loops of the ToggleLoc device reaches the entrance of the femoral tunnel. Pull on the distal end of the soft tissue grafts to feel the implant catch on the lateral femoral cortex, achieving femoral fixation. Ensure the zip suture is anterior to the graft and pull distally to draw the graft through the tibial tunnel and into the femoral tunnel. Correct placement is indicated when the mark on the graft enters the femoral tunnel. Retrieve the zip suture through the medial portal. Pass a 1.1 mm nitinol guide wire into the tibial tunnel and insert the desired composite TCP interference screw to achieve tibial fixation. Excise the remaining graft. Advance the Supermax cutter through the medial portal and sever the suture near the entrance of the femoral tunnel in the joint space.